Luckily, with FACE, it's a congenital disease. It doesn't change too much over time, but each letter, which stands for something individually, does have additional testing and ways that doctors follow them over time.
Welcome to the March episode of the CHC Podcast, Congenital Heart Conversations. I am Anna Jaworski and a heart mom to an adult with a single ventricle heart. I'm also the executive producer of the podcast. We have two co-hosts here today.
I am Edmund Beatty, and I have acquired long QT syndrome due to medication that I take for other conditions. I am also bereaved of my brother Edward, who died from an undiagnosed congenital heart defect.
Hello, I am Annie Alchak, and I was born with nomenclature hypoplastic left heart syndrome.
I am so excited for Ayrton and Annie to take over the interview portion of this episode. In the second segment, you'll get a chance to meet some of our patrons and volunteers. And my co-producer, Nicole Bilodeau, and I will join the conversation in the third segment. Take it away, Annie.
Today's podcast deals with FACE syndrome. According to the National Institute of Health, the prevalence of congenital heart disease, CHD, in patients with FACE syndrome is 41 to 67%. Coarctation of the aorta is responsible for 19 to 30% of the cases. And approximately 50% of patients with CHD involvement have an aberrant origin of the subclavian artery, with or without a vascular ring. For those listeners who are wondering right now, FACE is PHACE. P stands for posterior fossa. For instance, congenital brain malformations most commonly affecting the back of the brain, such as the Dandy-Walker cyst. H, which stands for hemangiomas, a benign vascular tumor or anomaly that in children with FACE usually appears as a red birthmark on the face, scalp, or neck. A, arterial lesions, abnormal arteries, usually in the head or neck. C, cardiac abnormalities, coarctation of the aorta, congenital defects in the heart and its major blood vessels. And E, eye or endocrine abnormalities.
March 17th to 24th is FACE Syndrome Awareness Week. FACE is an acronym that stands for medical name of the parts of the body this syndrome impacts. The FACE Syndrome website states that FACE syndrome is the uncommon association between large infantile hemangiomas, usually of the face and birth defects of the brain, heart, eyes, skin, and/or arteries. Hemangiomas are a type of growth that appears as red or purple lumps on your skin. They are made of rapidly dividing cells of blood vessel wall that frequently go away on their own over the course of years.
FACE syndrome was first defined in 1996, so we have a lot to learn about this condition. Here, to help us learn more about this condition, is Alexis Sinclair. Alexis Sinclair is mother to Haley, who was born with a coarctation of the aorta, which was discovered through Haley's FACE syndrome diagnosis.
Welcome to the CHC Podcast, Alexis Sinclair.
Thanks for having me. I'm thrilled to be here today.
Alexis, can you tell us about when you found out Haley had FACE syndrome?
Sure, absolutely. Haley was diagnosed at approximately 4 weeks of age. She was born with a very large red spot on her eye. If you imagine a lightning bolt shape from the top of her forehead down through her eye, almost touching her nose. Our pediatrician at the time was amazing and could tell something else was going on, not exactly quite what that was, but connected us with a team of doctors who quickly diagnosed her with FACE when they discovered that she also had a coarctation of the aorta.
Since the FACE syndrome diagnosis is less than 20 years old, it must be difficult to know about how Haley might do in the future. What does the FACE syndrome community know about long-term outcomes?
I think they're learning every day, just how the patients do. We ourselves are learning day to day, any sort of additional effects that might be happening to her. Luckily with FACE, it's a congenital disease. It doesn't change too much over time, but each letter, which stands for something individually, does have additional testing and ways that doctors follow them over time. For instance, Haley had the H, hemangioma, and C, the cardiac issues. And with the coarctation, we follow her yearly or 6 months to a year to make sure that it stays properly fixed. But then long term, there also could be blood pressure issues, which is normal for patients that have coart. So depending on what letters you have, I think they follow each person individually to make sure the long-term effects are minimized. Over time, we have discovered certain things like PHACE syndrome does tend to have eye issues. And while Haley doesn't have the standard face eye issue, she does have other issues, weak cornea, bad eyesight. So not directly related, but because it is so young, over time, they may discover that that's also part of it.
Oh, wow. Thank you. PHACE syndrome encompasses a constellation of conditions. On this podcast, we typically focus on congenital heart defects, but that is a small part of Haley's overall diagnosis. Alexis, can you tell us what conditions Haley has that concern you the most?
Yeah, it actually is the cardiac issues that we worry about the most. The hemangioma goes away over time, as I think you stated earlier. Also, Haley was treated with propranolol. Interestingly enough, they found that years and years ago, a patient with a blood pressure issue who had a hemangioma and was treated with propranolol, it solved for the hemangioma. So that is how we treated her. She still does have some remaining vessels that are close to the surface and therefore visible. As a young girl, I do worry about what that will do or if kids will be mean to her. That's the issue there. And then the eyesight, as I mentioned earlier, we're always keeping a close eye, especially on her cornea, but mostly the coarctation and just ensuring that as she grows and her body changes, that the flow is as it should be.
Yeah, I can imagine that dealing with any type of congenital heart defect for a young child is difficult. It can be made more difficult with other health issues going on at the same time.
Yeah, it's always difficult, but I think you only get what you can handle. We've been very lucky, and her team of doctors are amazing and are there for us. And I think that's been really important as we've been going through this. I've always trusted our doctors and gone with her father and my gut, and I'm glad we did.
Anytime a person looks different from most people, bullying can occur. Is this a significant issue in the PHACE syndrome community?
I think so. It was amazing, especially as Haley was a baby with the hemangioma, which grows over time. It comes off the skin, turns a very deep red and purplish color. The comments I would get from parents, actually, or people out and about. I mentioned that I'm concerned for her over time and what that will mean with the remaining vessels as they fade, but also what it did to Tim and I as we had a newborn. Haley was our first baby. And people out at the grocery store or at play groups would question us and say, "What happened to your child?" in a almost accusatory, rude, staring way. It was amazing to see actually that the young kids, the 2 to 5-year-olds, were the kindest about it. Once they realized it wasn't something that hurt her, they were very happy to say it was beautiful, say how interesting it was. But I do get concerned about how kids will be because unfortunately that can be tough.
What can we do as a community to help those with PHACE syndrome deal with the bullying issue?
I think just awareness, podcasts like these, having folks out in the community just to talk about it and make it more well known. The hemangiomas go away over time. So when I see someone with a child that has a hemangioma, trying to say like, "Hey, my daughter had one and it's gone. Look how good it is," making them feel welcome to ask questions. It's a sensitive thing and you never know how adults are going to answer. So I think like anything else, the more it becomes normalized, the easier it'll be for everybody.
Yeah, that's wonderful. And speaking of that, making more awareness happen, can you tell us about the PHACE Syndrome Week, what it means to you, and why we should help promote awareness of PHACE syndrome?
Yeah, absolutely. I'm so glad that PHACE syndrome is now recognized and that we have a week celebrating it, and especially Congenital Heart Month. A lot of people don't know about PHACE simply because of how young it is. And because hemangiomas do fade over time, I think it's important that PHACE and information is out there because children have it. And if they don't have the hemangioma anymore, it's not as easy to diagnose. I keep saying how Haley only had the 2 letters, but if there was others out there who had more of them, if they don't know about it, that there could be that you have one thing and it could mean you have another. It's just, how are you supposed to treat it? So I love that there's more awareness, that groups are out in the community. And if we can help one person realize that, hey, they need to get checked out or their child needs to get checked out, I think that's really important. The age of just 20 years since it's been discovered means there are probably 40-year-old adults out there who had one thing, but may or may not have something else. And knowing the association or doctors being aware of the association, I think that's only going to help others get diagnosed, get treated, and live a long life.
Definitely, it's something that I knew very little about. In fact, it was a syndrome that I'd never heard of before until I came across it on the heart defect website.
Yeah, when we first got diagnosed, we had doctor after doctor coming in to just meet her and see her and check her out because, again, nobody had really seen a patient that had it because it was so rare at the time.
Thank you for sharing so much information with us, Alexis.
Yeah, my pleasure. Thank you so much for having me and for making awareness surrounding FACE and congenital heart disease.
And thank you for making us aware as well. All right, everyone, we're going to take a short break. And when we come back, it'll be time for our patrons to ask questions or share their experiences with us.
The CHC Congenital Heart Conversations podcast is a presentation of Hearts Unite the Globe, or HUG, and is part of the HUG Podcast Network. HUG is a nonprofit organization devoted to providing resources to the congenital heart defect community to enrich the lives of our community members. For free CHD resources, please visit our website at congenitalheartdefects.com.
You are listening to the CHC Podcast. If you have a question or comment that you would like addressed on our show, please send an email to Anna Jaworski at anna@thechcpodcast.com. That's anna@thechcpodcast.com. Now, back to the CHC Podcast.
Welcome back. We're talking about FACE syndrome today, and now our patrons are able to share their experiences or ask questions of our guest, Alexis.
Hi, Guy. I see you have a question. Everyone, Guy is one of our CHC volunteers.
You said it found out when she was 4 weeks old, correct?
Hi, Guy. Yes, she was 4 weeks old when she was diagnosed with the coarctation of the aorta, the hemangioma, and then was confirmed to have FACE syndrome.
What's she doing now?
Thanks for asking. She's doing wonderfully. Very active, happy, and a special child. At least I think so. We look forward to seeing her team every year. They really built an amazing relationship with her. Now that she's coming a little bit older, 10, she does sometimes ask why this happened to her. It's just a transition, but she's doing great.
Glad to hear.
Thank you.
You're welcome.
I see Frank Jaworski. Frank is also a volunteer with the CHC. You have a question?
I do, actually. I have a question for Alexis. I know a little bit that I've read about FACE syndrome is that there are 5 different factors involved, and you said that your daughter was diagnosed with 2 of them. Is that the criterion? If you have 2 or more, then you consider to be part of FACE syndrome? Because the incidence is less than 1 in a million. It's very rare.
Thanks for the question, Frank. Yes, that is correct. If you have 2 of any of the letters, then you are considered to have FACE syndrome.
Thank you. I've been practicing as a nurse and as a nurse anesthetist for 30 plus years now, and I've never seen a patient with FACE syndrome. And I think I'd heard about it once before ever. So that's an unusual situation to deal with.
Yeah, thank you. And thank you to all the nurses. I have to say, when she was in for her surgery, we wouldn't have made it through without them, just for support for her and support for us. I am so thankful for her team.
Well, for all the nurses out there, you're welcome.
So, Alexis, I actually have a question. I have seen some of those patients when I get my yearly checkup at Boston Children's Hospital. I'm part of the BAC team as a patient. I have a congenital heart defect, and I had always wondered when I saw babies and young kids with the hemangiomas. So learning about this and reading about it beforehand was actually quite interesting. How often does your daughter go now to get her cardiac checkups?
Yeah, thank you. She goes yearly for cardiac checkups unless there's something else going on. Believe it or not, she had a case of septic hip. We had a tough year. She's doing great from that as well. But depending on what happens, any sort of illness, we may see them more. She had COVID early on. So that year we saw them more just to check that everything was doing great. But in general, they want to see her once a year. And after puberty, it could go from anywhere between 1 to 3 years.
Wow. Thank you so much. Anna Jaworski, who is our executive producer, you have a question?
I do. I'm kind of surprised that she wasn't diagnosed until she was 4 weeks of age. Was that because the hemangiomas were really small, but then as they continued to grow, they became more apparent? And that's what cued the pediatrician into wanting to dig deeper to see if she had a problem?
Yeah, exactly. Thanks, Anna. Hemangiomas generally, when you're born, look almost like a strawberry or like a mark in which they were leaning on a bone, and they get redder and redder as the days go on. They're fairly common. You normally see them on kids, mostly female, with like a circle. So Haley's was misshapen. That is another way to tell that it might be face syndrome, and also extremely large. So I think the requirement is it has to be over 5 centimeters. Hers was inches. And so that was happening. But then also she had failure to thrive. She wasn't eating well or growing. She was very tiny. And interestingly, with a cohort baby, as many on this call might know, your upper pressure is higher than your lowers. Haley actually had really good pressure, which is unusual. Trust your doctor, go with your gut. My pediatrician was simply amazing and helped us get to the right place to figure out what was going on.
So my child was also born with a coarctation of the aorta. And when the doctor was telling us about it, our child had surgery as an infant because she also had a lot of other problems. And the coarctation was not the most pressing of her problems. But we were told that there was a possibility that the coarctation could come back. So it sounds like she has not had surgery for the coarctation. Am I right about that?
I hope your daughter's doing well, first of all. She did have surgery. So Haley had a correction at 6 weeks of age. We were in the hospital for several weeks. So once she was diagnosed, we were almost immediately sent to Columbia University. And then we were there for several weeks as they fixed the cohort and then also did some studies on her for the rest of PHACE syndrome. And I'm sure they've said the same thing to you. As she grows, puberty will be a very important piece of time to just make sure that the flow for the cohort stays steady.
Right. I'm so glad that she's doing so well. Our baby turns 30 this year. So yeah, she's doing really well.
Yay.
And she has not had a recurrence of the coarctation, but that certainly was something I was concerned about. But she was born with a variant of hypoplastic left heart syndrome. So she's had a Fontan procedure, which is pretty involved. And thankfully, the coarctation has not been the major issue for her.
Well, most importantly, I'm so glad to hear she's doing well, and happy birthday. 30's a good one.
Yeah, it'll be in August.
Okay.
It'll be here before you know it. These kids grow up so darn fast.
Yeah, totally agree.
Alexis, do you have a group, whether it be in person or on Facebook, online, that you are able to talk to other parents whose children also have face syndrome?
I don't have a lot of face syndrome friends. As it was mentioned on this call, it's hard to find, but I do have a great group, the Mended Hearts Foundation, which through her cardiologist here has connected me. And we do in-person events. There's support group for the parents. There's support group for the kids. So as I mentioned, Haley's beginning to have a lot of questions, and it's kids helping kids, adults helping kids, and parents. So it's been great to have the community. I think that's really important, especially as they get older, to ask questions.
Yeah, they are a really great group. They do everything they can to try to connect people and give them a community that, at times you feel so alone in. So I'm glad you were able to find them. I know I'm good friends with some of those who are up here in Massachusetts. Anna, I see that your hand's up again.
Yes, you know me, I always have a million questions. So, Alexis, I'm curious whether or not you have special plans for the Face Syndrome Awareness Week. Is there something special you and your daughter will do?
Thanks for asking, Anna. I wish we would do more. In general, we talk about her face syndrome, we look at pictures. In the past, I've gone back to the hospital. I think for this year, just due to craziness of schedule and having a 10-year-old and 8-year-old just running around, we probably won't do too much except, again, revisit the pictures and talk about it, make sure we answer any questions. That is most likely it. But in the future, yeah, definitely hope to do more.
Thank you. I think it's great that you're working to help raise awareness. I remember what it was like when we first started making CHD Awareness Day, and that was over 20 years ago. And it was rough at first because a lot of us weren't sure exactly what we should say, but we started with a proclamation with our governors. So is that something that the FACE community has considered doing? Because the first thing that our community did was work to get CHD Awareness Day and actually get proclamations from our governors. And before we knew it, not only was every single state in the United States taking part, but we had different countries overseas also taking part in Congenital Heart Defect Awareness Day.
I don't know, honestly, and that's a great point, but it sounds like you've given me some excellent homework to check in on and see how we can do more in general. So I'll have to get back to you on that.
Absolutely. If you need some help, I'd be happy to help you.
I am going to look into it and definitely may tap you for assistance.
Absolutely. That sounds great.
Thank you, everyone, for participating. There were some really great questions here. Alexis, thank you so much for all your answers.
Thanks, Annie. Thanks, everyone.
We shall return.
This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The opinions expressed in the podcast are not those of Hearts Unite the Globe, but of the hosts and guests, and are intended to spark discussion about issues pertaining to congenital heart disease or bereavement.
Welcome back. It's now time for Anna Jaworski and Nicole Ellidu to talk about this episode with Annie and me. Anna is a heart mom, and Nicole discovered she had a CHD as an adult. They were working behind the scenes as producers during the first 2 segments of the podcast episode.
So, what did you guys think about the show?
Well, I'll go first. I was very impressed with this episode because before I worked on the script for this show, I didn't really know anything about FACE syndrome. And Alexis is so well spoken, and she really seems to have a good handle on what it is, even though it's a really new syndrome. So I'm very impressed with how educated she was on the syndrome and how well her daughter is doing. When I was doing my research to put the script together, I was looking at pictures of children who have been affected by it. And the hemangiomas look a little bit scary, and it makes you wonder what other involvement there may be. So I was really happy to hear that the only involvement that her daughter had was a coarctation. Not that that's something to not be concerned about, of course, because we know that coarctations can be serious as well. But just knowing that she didn't also have to have involvement in all of the other organs to be classified as having FACE syndrome, I mean, it clearly shows you that there's a spectrum of people who can be classified as having FACE syndrome. Apparently, Alexis's daughter, Haley, was not as severe a case as what there might be out there.
Nicole?
Like Anna, prior to the recording of this and even reading through the initial script, I truly had no clue what FACE syndrome was. So it was very educational, but overall, this podcast in general has been educational for me as somebody that didn't know about her CHD until she was an adult. So I learned something every episode. When we were putting a list of topics that we could do for this podcast and FACE syndrome came up, we were all like, what is FACE syndrome? We've never heard of that.
Yeah, I have to agree there.
Exactly. That's why we knew we needed to do something about it.
Exactly.
What surprised you the most?
Well, I've been in the CHD community for 30 years. So I've heard of different syndromes. There's Noonan syndrome and there's Batter syndrome. And there are so many different syndromes that I've learned about, but I did not learn about FACE syndrome until this episode really had me do some studying. And I think what surprised me most was that with a lot of the other syndromes, it seemed as though people had to have more issues to be classified as having that syndrome. So the fact that her daughter had 2 out of 5, I was just a little bit surprised that there was a syndrome classification for something that only had 2 conditions. Now, I know that because this is so new and because her child was so young when diagnosed, that she's at risk potentially for some of these other conditions. And so they're keeping an eye on her. But I am a little bit surprised that they came up with a name for a syndrome, but her daughter only had 2 of those conditions. So that's what surprised me the most.
I was going to say the same thing, that I was surprised that there's 5 different pieces to this. You only needed 2 in order to actually be diagnosed with it. Not to say that 2 out of 5 is great, but it was the minimal amount that surprised me.
So I think for me, what surprised me is that there is a medication to help treat that, and that your daughter, Haley, was able to take that and make the redness on her face become less and less. And from what it sounds like, luckily, and I could be wrong, so Alexis, please say anything if I am, it sounds like the hemangioma is not painful. So for me, that was a little surprising too, because when you look at it, it does look like it might be painful, but luckily it's not.
Yeah, I can say that luckily they're not painful. They can ulcerate and bleed, especially if they get bumped. So in those cases, it can be painful. The other thing is they grow and the skin becomes raised until they start to involute and eventually disappear. So depending on where they are, they often do want to treat them. So again, Haley's came over her eye. And some of the concerns was if we did not treat it, it would make her lose the eye because it would eventually take over. It does take several years to be removed on its own. So I think depending on where it is on the body determines where they would treat it. We've seen kids or known kids that have them on their nose where as it grows, it closed up their breathing. So that had to be treated over their mouth to make it hard for eating, things like that. But as I mentioned, in general, they're very small and they're round and over time just go away on their own.
Alexis, do they know what causes it?
No, at least that I've never heard. And ironically, my niece was born with one, round shaped. She did not face or any issues, but they are fairly common, again, especially in females.
It's amazing that it gets bigger and bigger until all of a sudden it stops growing and then goes backward. What happens with the 20% that don't get smaller? Are they able to treat it? She's taking a drug for that, right? Or is that finished now?
She took that from about 6 weeks to about 15 months of age. I'm fascinated by the fact that they found it just ironically through treating a child that had one with blood pressure issues. One of the options we were given before we knew she had bigger issues was laser treatment, which would have been painful. The other is if we just naturally let it go on its course for any skin that was remaining, because again, it does get raised, there could be skin removal. So the medication was the easiest, safest, and fastest way to remove it.
Yeah, laser treatment is incredibly painful because I've had that on the birthmark before, and it didn't actually remove the birthmark, it just caused the whole bloated face.
I'm so sorry. That's terrible.
What was your biggest takeaway from the show? Nicole, what would you say?
For me, it was the educational piece. Like I said, every month I get to learn something new about the CHC community, and I had no clue that this existed, much less what the diagnostic criteria is, or even what kind of treatment there are for any of the different pieces.
Thank you, Nicole. Anna?
Yeah, I love that, Nicole. That's awesome. I think for me, the biggest takeaway was that Mended Little Hearts has been so supportive. And I think it's great that we have these nonprofits out there who are willing to help kids with all different kinds of conditions. And since the coarctation really was the major issue for Alexis's daughter, Haley, I'm glad to hear that Mended Little Hearts was able to come forward and give her some support because it sounds like there isn't a whole lot of support for the PHACE syndrome community at large. and maybe that will change. But since it is such a rare disease, it's hard to put people together to actually form a community. So I'm really happy to hear that Mend a Little Heart stepped up and provided Alexis and Haley with the support that they needed.
Yeah, it is wonderful about those nonprofits and being able to help others. Ayrton, any thoughts from you?
Like Nicole, I've learned so much about PHACE Syndrome today. Alexis has shared so much about what her daughter has gone through and has been so well spoken about it. And hopefully this podcast can help raise some awareness about this syndrome, and maybe we can help build up some support for her.
Yeah, that would be great, being able to get more people aware. Frank, any thoughts?
I think that since our child was born with a heart defect, we discovered an enormous community of people who are supportive of each other in this situation because of their own children and their own situations. I find it fascinating that the incidence of this illness is so low, that people that actually suffer from PHACE syndrome, not an isolated heart defect, are so few in number. I think it's great that there is connection, that they can support each other. I think it takes a lot of courage to go through this, and I applaud Alexis and her family, and I hope her little girl does well.
Wonderful. Thank you, Frank. Guy, do you have any thoughts?
Like everyone else, I also found it very fascinating to hear from Alexis and what her daughter has been dealing with, and hope that as she grows up, Haley becomes more involved herself.
Thank you, Guy. I think it's quite fascinating. Like everyone else has said, it's always educational, learning something new. I'm always so fascinated to know what else goes on in our CHD community and how it affects so many other people in different ways, but also how we come together too. And thank you, Alexis, for this whole podcast and teaching us all about something that I know I've seen and I've never known before. And now I'll be able to understand and perhaps maybe even talk to some of those parents that are in the waiting room. So thank you for that.
Yeah, thanks. If I can just jump in and say thank you for having me, and thanks everyone for your questions and well wishes. The more information to get out there, I think the better. And yeah, I'm really appreciative of today.
And we appreciate you.
Thank you for joining us today on the CHC Podcast. We hope you'll join us next month for our National Transplant Awareness episode.
Until then, I'm Annie Alchak.
And I'm Ayrton BT.
Have a great day and keep those congenital heart conversations going on Facebook and Instagram.
And TikTok.
Thank you for joining us. The CHC Podcast can be heard monthly wherever you get your podcasts. Visit us on Facebook or Instagram to continue the conversations. Join the Hearts Unite the Globe Patreon group and become part of our town hall meetings. It's simple. Just visit www.heartsunitetheglobe.org and select the tab that says Donate to Hug with Patreon. Then you too can be part of the conversation.